comprehensive analysis of human metapneumovirus HMPV and its global impact. A new wave of concern has swept across the globe. China is experiencing a significant rise in human metapneumovirus, or HMPV, cases, sparking fears of a potential new health crisis. But how serious is this threat, and how is the world, particularly India, responding? Let's unravel the story behind HMPV. First identified in 2001 in the Netherlands, human metapneumovirus, or HMPV, belongs to the Pneumoviridae family, the same as the well-known respiratory syncytial virus, or RSV. This respiratory virus primarily affects the very young, the elderly, and individuals with compromised immune systems. In most cases, HMPV manifests as mild symptoms similar to a common cold. However, in vulnerable populations, it can lead to severe complications such as bronchitis, pneumonia, and in rare cases, respiratory failure. The virus spreads primarily through respiratory droplets when an infected person coughs or sneezes. It can also spread through direct contact with infected surfaces and close personal interactions, such as handshakes. The current situation in China. Reports from China indicate a worrying rise in HMPV cases, particularly among children under the age of 14. According to the Chinese CDC, HMPV has become one of the top 4 viral infections among hospital visitors. The World Health Organization has also taken note, highlighting the uptick in respiratory infections since October 2024. While China's northern provinces report the highest cases, health experts are urging caution rather than panic. India's vigilant response. Meanwhile, India's Union Health Ministry has been closely monitoring the situation. According to Dr. Atul Goel, Director General of Health Services, there is currently no cause for alarm. Dr. Goel stated that India's respiratory disease data for December 2024 showed no unusual spikes. However, the National Center for Disease Control remains vigilant, in constant communication with international health agencies. India has also ramped up testing for respiratory illnesses to ensure early detection of any unusual outbreaks. How does HMPV spread? Like many respiratory viruses, HMPV spreads through respiratory droplets, direct contact, and contaminated surfaces. When an infected person coughs or sneezes, tiny droplets containing the virus can be inhaled by others. The virus is most active in late winter and early spring, coinciding with flu season. Knowing how it spreads is crucial to implementing effective prevention measures. Unlike other respiratory viruses, HMPV has an incubation period of 3 to 6 days. Symptoms can last from a few days to over a week, depending on the severity of the infection. Precautionary measures. The best defense against HMPV is prevention. Here are some essential steps to protect yourself and your loved ones. Also, check the description below for links to purchase essential items like masks and hand sanitizers to keep yourself protected. The best defense against HMPV is prevention. Here are some essential steps to protect yourself and your loved ones. Wash your hands frequently with soap and water for at least 20 seconds. Avoid touching your face, especially your eyes, nose, and mouth. Maintain physical distance from individuals showing symptoms of respiratory illness, and disinfect frequently touched surfaces regularly. If you experience symptoms like cough, fever, or congestion, it's crucial to isolate yourself to prevent spreading the virus to others. It is also advisable to use disposable tissues when coughing or sneezing, and immediately discard them after use.
Are you enjoying the video? Don't forget to hit the like button, subscribe to our channel, and turn on the bell icon so you never miss an update. Share this video with your friends.
Comparing HMPV to COVID-19. It's natural to compare HMPV with COVID-19 given the timing of this outbreak. Both are respiratory viruses that spread through droplets, but they differ significantly in severity and transmission dynamics. Unlike COVID-19, HMPV has been around for decades, and its seasonal patterns are well understood. While COVID-19 triggered a global pandemic, HMPV's impact is generally limited to localized outbreaks. Treatment and medical care. Currently, there is no specific antiviral treatment or vaccine for HMPV. The management of the virus involves supportive care, such as rest, hydration, and over-the-counter medications to relieve symptoms. In severe cases, hospitalization may be required for oxygen therapy or mechanical ventilation. Researchers are actively exploring vaccine candidates, but until then, prevention remains our best strategy. For children, it is important to monitor symptoms closely and consult a doctor if any severe symptoms like difficulty breathing or high fever occur.
The economic effects of HMPV outbreaks may not be as severe as those caused by a pandemic like COVID-19, but they can still be significant. An increase in hospitalizations and medical care costs, especially during peak flu seasons, places additional strain on healthcare systems. Businesses, especially in sectors like retail, hospitality, and travel, can experience reduced productivity as employees take sick leave. This can slow down local economies, particularly during prolonged outbreaks. In addition to direct healthcare costs, indirect costs include lost workdays, reduced consumer spending, and increased pressure on public health resources. For instance, families caring for sick children or elderly relatives may need to miss work, leading to lost income.
Global health implications. The rise in HMPV cases is a reminder of the interconnectedness of global health. Continuous surveillance, robust healthcare systems, and international cooperation are essential to managing such outbreaks. With India and other countries remaining vigilant, the focus is on early detection and rapid response to minimize the virus's impact. It is also crucial to address public misinformation and ensure that citizens receive accurate and timely information from trusted sources. Key takeaways for the public. To summarize, while the rise in HMPV cases in China is concerning, it's important to stay informed and proactive. Follow the recommended health guidelines and trust in the preparedness of healthcare systems. Together, we can face these challenges with resilience and care. For more updates on global health and safety tips, don't forget to like, share, and subscribe. Stay safe, stay informed. Thank you for watching, and we'll see you in the next video. Don't forget to check the description for helpful links to buy protective masks and hand sanitizers on Amazon.